All right, thanks a lot, Carly. Well, they say the upcoming holidays are the busiest time of the year in cosmetic surgery offices.
Yeah, that's right. Dr. Adam Scheiner, he joins us here to tell us the important questions to ask ahead of booking an appointment. Dr. Scheiner, thank you so much for being with us this morning.
Thank you so much for having me.
Now, let's get right to it. How can someone make sure they're a good candidate for the procedure they're wanting?
Getting evaluated by your surgeon and asking your questions is the best way to make sure a person is a good candidate for a specific treatment.
Okay.
Interesting, yeah. And what about like people who they may think like I might want to do that, but it's probably crazy expensive, way out of my means. What would you say to someone like that?
You know, right now a lot of different surgeons have financing available for people, so that can, you know, people can find they can budget in certain ways. It makes it very affordable for people to have these things done.
Dr. Scheiner, tell us, is plastic surgery kind of like taboo, kind of like a thing in the past? I know a lot of people have been doing plastic surgery on many different things lately.
Sure, yeah. You know, it's really not taboo. You know, modern techniques and new societal acceptance of surgery to help appearance has come about especially today on social media. We have a lot of social media posts about people having procedures done, and it's really interesting. So people can look, you know, sad like this photo, and we can do procedures to make them look not as mad or sad.
Yeah, and how about risks? Do you get a lot of questions, Dr. Scheiner? People are like worried, you know, because it is, you know, at the end of the day, it is surgery, you know?
Absolutely. You know, treatments with a qualified surgeon have very low risks, thankfully. Some patients can have issues with longer healing from treatments that can require some hand-holding from the physicians, but in general, you know, a lot of the treatments today are very, very safe to have done.
Dr. Scheiner, I know a lot of people have gotten surgery and they've gone out of the country to do it because of the cost. You just mentioned, Pat, how expensive it can be to do it done here in the States. What are your thoughts about that? Is that more dangerous?
Yeah, that's a little bit of a chance because afterwards there can be issues that people have, and then it's sometimes hard to find, you know, people in the States who want to take care of people who've had surgeries done in other areas. So that can be challenging for them.
Interesting. And let's say you're going to get like a facelift, Dr. Scheiner, or something like that. Like, how long would you need off of work? Like, you know what I mean? Like I'm guessing you're not camera ready the next day.
Right. You know, most surgeries,
Asking for a friend.
within about 2 weeks, most people are usually good to be back, you know, in the light. Usually I say about two or 3 weeks they're, you know, supermarket ready, and usually by about 3 months they're wedding ready.
Oh, wedding ready.
Okay.
Okay.
So, but I suppose it's worth
And
it.
I would think that would help with your confidence, right, Dr. Scheiner?
Absolutely. You know, there's studies that have shown that appearance has an impact on wages and the way the world treats us, and looking our best influences the way that others see and treat us.
Oh, yeah, you know, and we're just about out of time, Dr. Scheiner, but yeah, you just reminded me, and I'm sure you've seen this, the uptick since all the Zoom stuff. People like were seeing their face a lot more than they used to, and so they were coming in to have stuff done.
Right, they call this thing, you know, the Zoom fatigue, and even on these apps and things, people see themselves more that they might see things a little bit irregularly than they really are in real life, and that is driving people into offices now more, yes.
Oh, wow.
All right.
Well, thank you so much, Dr. Scheiner, for being with us this morning.
Thank you guys so much.
All right, good stuff.